Hi, I'm Alexander Digenis, and I'm a plastic surgeon, board certified in Louisville, Kentucky, and I'd like to talk to you a little bit about body contouring. Body contouring involves liposuction or abdominoplasty, which is commonly known as a tummy tuck. We have lots of women, particularly those who are athletic, who have difficulty losing areas of fat storage on their hips, thighs, and abdomen. And liposuction really should be called liposculpturing because it's really not a weight loss type of procedure, but it's one in which helps put things into better proportion. It also takes down areas that are resistant to diet and exercise. I'm going to, at some point I tell my patients, I'm going to tell them about what they should beat themselves up about and what they can't. We often advise patients about their total health, diet, exercise, etc. But there are some things, particularly in a woman's body, that they can't fight, either because of genetic predisposition or the fact that they undergo pregnancy or that their body prepares to go through pregnancy. So women's bodies change dramatically after puberty due to both genetic and hormonal as well as these environmental influences that lay down extra layers of fat, stretch out muscles, as well as stretch skin. It's amazing to me as a physician that many of these different anatomic structures even come back to any normalcy. So I tell patients a lot of this is almost putting things back where they should be. So in liposuction, this usually involves very small incisions in which cannulas are placed to literally suck out different layers of fat under the skin in localized areas. The procedure should really be called liposculpturing because it's not about weight loss. It's about trying to reduce these more difficult to lose areas. And so you'll see in the media a variety of different types of names for liposuction, which I think for the most part is hype. I sit on national societies that look at a variety of these new, so-called new techniques, which include liposuction using lasers, liposuction using ultrasound, liposuction using water jets. And although these are marvelous, sexy marketing advertisements, in general, they don't add a lot to the standard advances in liposuction that in fact were developed by many of the last generation of surgeons, including our very own Dr. Norman Cole, who was here and was one of the first surgeons to do liposuction in the United States. These techniques have advanced, and there are true advances, but unfortunately they're not usually represented by the marketing campaigns. So I encourage you to come talk to a real board certified plastic surgeon to find out whether or not they apply to you. I also am a strong proponent for doing them in safe places. Liposuction, because many times it can be done in a small area and done as an outpatient, is often promoted in outpatient surgery centers. And I find that often larger and larger procedures are done inappropriately in places that might not be safe for patients. So in general, when we put together a plan, we try to evaluate where the safest place is to do these procedures. And we have a wide variety of options, including hospital-based surgery as well as office-based, to try to deal with some of these issues. In addition to liposuction, we do tummy tucks, and that, like I just explained, involves many times very thin women who've lost the strength of their muscles because basically the muscles have been splayed or been pulled apart. So no matter how much they exercise, it's frustrating because those muscles are off to the side rather than where they're supposed to be prior to the pregnancies. So many times the tummy tuck isn't just about taking out excess skin or fat, it's about tightening the muscles inside and in many ways reconstructing the abdominal wall. And since we're all living longer, this is about living healthier and putting things back to the way they should be. So I tell patients many times this is often really should be considered reconstructive surgery because we're putting things back. In addition, we usually take out excess skin, particularly after patients who've had C-sections. The C-section scars often cause an indentation and a roll that makes the lower part of the abdomen difficult to camouflage and close. And so we often find that tends to be an important part to recontour the abdomen, meaning the belly as well as the sides, through these various two techniques of liposuction and abdominoplasty. If you'd like to have more information, please don't hesitate to call us ask questions. We'd love to send you some information, as well as see you in consultation to give you a personalized program, as well as advice about what the best options are for you. Thank you.